You can't get HIV by using the same toilet, utensils, sleeping on the same bed, towel with someone who has it. They can achieve their goals, they can achieve their dreams. Hi everyone, and welcome back again to my YouTube channel. I hope you all are well today, and I hope you all are taking good care of your health. Thank you for stopping by. Thank you for watching this video. If you are new, special welcome and thank you. I am Regina Mmadu, a pharmacist. In this video, I will be discussing about the treatment of HIV and clearing misconception about HIV and few advice. It's a continuation of the last video, so if you have not watched the last video, please go and watch it. So HIV is treated with antiviral drugs called antiretroviral therapy. There are many drugs in this class, and it's treated with combination of drugs. It's not treated with just one single drug. It's either combination of drugs of different tablets or combination of drugs punched together or produced together in one tablet. So HIV treatment is not what you say, okay, let me go and buy over-the-counter medication, I'll be fine. No. If you have HIV, you must have to work with healthcare provider to get appropriate treatment. Before treatment to be started, diagnosis have to be carried out, and once the test is confirmed to be positive, another test that will be carried out, that is to check the CD4 count, and depending on how much the CD4 have decreased, the treatment will be started and the appropriate drug will be selected. So it's not something you can just do alone. And the diagnosis is carried out with a laser test, or will I say HIV test strip. So after that one, before the confirmation of CD4 count will be done, and with this medication there will be prescription of diet that will help to boost the immune system and also keep the individual healthy overall. These tablets have to be taken every day. It's not like anti-malaria drug that you have to take until the malaria clears off and then you become okay. Remember that HIV is incurable. It's only manageable with drug. That is to say, you must have to take your medication every day, and the best way to take them is to take them at the same time every day. One thing is that if you don't stick to treatment properly, because it's microbes and virus mutate easily than any other microbes. So if you don't stick to treatment properly, there's a chance that this virus will develop resistance. The misconception I will be clearing about HIV, or like what you need to know about HIV in this video are: HIV is not a death sentence. Before, once someone has HIV, it's like obtaining a death warrant, because they just have a few years to live and that is over. And that is because little were known about HIV and less effective drugs were available. But these days, there are more effective drugs than before. With this drug, people with HIV can live near to normal life. So instead of maybe you watching me, you tested positive, to start thinking, oh, my life is over, my dreams, my careers, my goals, everything is doomed, I cannot even do anything with my life, and then you thought of committing suicide. It's not an option. And that thing is, I don't even need to say it, is that HIV is stigmatized in our society. Yes, it's attached with so much shame, as if it's the worst thing that can happen to anybody, or it's a punishment from God for those who are worse sinners. But remember that HIV is not only transmitted through sexual intercourse. There are other means through which HIV can be transmitted. It's not like a punishment that God used to punish those that sleeps around. What I'm trying to say here is that the stigma that is attached to HIV has led so many to death. But in order to stop many from dying from HIV, we have to change our orientation. Because of this stigma, someone might have HIV, they will not undergo treatment because they don't want their family member or friends to know that they have HIV. What will they tell them, or this or that? Because they refuse to take treatment, they will die earlier than they should. And apart from that, with the stigma, people don't even want to go for diagnosis, making it to be diagnosed at late age, that is to say at 8th stage, when the immune has been severely damaged. Even though treatment can elongate these people's life at this stage, but not to compare not compared to when it is diagnosed early. So let's try to take it like every other disease that everybody suffer from. It's true that it's lifelong disease, it's incurable, but if we see it like every other disease, then people will be able to manage the disease. Apart from what the two I mentioned, the pain they will suffer from being rejected will contribute to the disease they are suffering from, because it will affect the overall health and the immune system, having the HIV to kill them more and more. Another thing is that HIV is not contagious. You can't get HIV by body contact with someone who have it. In the last video, I mentioned the mode of transmission of HIV. Here, I'll try to emphasize on it. You can't get HIV by using the same toilet, utensils, sleeping on the same bed, towel with someone who has it. You can only get HIV from an infected person if you have anything to do with their body fluid, except from sweat. You cannot get HIV by mosquito bite. Otherwise, all of us would have been infected. You don't need to avoid those who have HIV because they think they might transfer it to you, just like COVID or Ebola or other flu. HIV is not like that. It only moves in the blood or body fluid, apart from sweat. People with HIV can live normal to near normal life, like I said earlier. I'm saying it because those that may think, oh, because you have HIV, that is the end of your life. No. With medication, someone who has HIV can have a viral load undetectable. That is to say, viral load can be minimized on the extent that it cannot be transmitted to someone else. Those who have HIV withdraw can bear children who are not HIV positive. So these people can live normal life. That is what I mean in this term. They can achieve their goals, they can achieve their dreams. And that thing is this: HIV is not a spiritual attack. That is to say that someone tested HIV, then it's inflicted on them spiritually. If maybe there is nothing, they don't have any contact with anything that has to do with HIV and it happened, yes, maybe it will be true. But what I'm trying to say is for someone to relax, maybe they tested positive for HIV, and instead of taking the next step, which is treatment, they go to the church and sleep there for months, for years, asking for healings, why they're not doing what they're supposed to do. I'm not against God. I'm not against that. No, I'm not saying that God cannot heal. God can heal. God perform miracle. He's all powerful. But for you to go and to sit in the hospital for years, for months, and allowing this to eat your body more and more, asking for miracle, is what I think it doesn't make sense. So if you test positive for HIV, the first thing first is to start treatment. While treating yourself, you can be asking God for healings, and He will do at His own time. But abandoning yourself and letting this to kill you gradually while asking for healing is what I am not in support of. And many will be like, oh, there's nothing like HIV. I don't believe in that. I don't have HIV. Me, a man of God, I'm very close to God. I can't have HIV. And you have washed yourself within and see that you have done something that you are supposed to, and you are there saying, oh, you are so close to God, you can't have HIV. And you say, God, this is not possible. The enemy is attacking me. You run to the church, you pray, and abandon the treatment you are supposed to take, which is the first step. It's not wise to me. So if you test positive for HIV, start the right thing, which is the treatment, while asking God for healing. The thing is that HIV is incurable. So there's no amount of drug or how many years you take drug and then you test the blood and it's become negative of HIV. Currently there is no cure for HIV. Though some people are claiming that there is traditional way of curing it, I don't know. But with English system of medicine, there is no cure for HIV. So there is no amount of tablets you take and HIV will disappear from your blood. Unless if you prayed, or maybe you were prophesied, someone prayed for you and said you are healed, go and test, it's negative. But for you to think, oh, with drugs, I've been taking these drugs for years, I should be done with HIV, let me just quit. Okay, even though you thought that you have taken it for long and you have to quit, at least go test and see if it's actually out of your blood before you quit the medication. Because if you don't stick to the medication properly or you skip medications, it will make the virus to be resistant to that drug. It make them to mutate, and maybe when you start the medication over again, it may not be effective. And with this, if this repeats constantly, almost all the HIV drugs will not be effective for you, and that is the worst of HIV and any other infectious disease. My advice is that if you are pregnant, you should go test for HIV, because this will help you to be on a safer side and your born child. If you don't test for HIV and you carry out the pregnancy and born, if you are positive for HIV, your child will contract it as well. And I know nobody wants to see their children suffer from what they are suffering from. So in order to be on the safer side, if you are planning or if you are pregnant, just go test for HIV in order to be on a safer side. Because if you happen to test positive with the help of the doctors, you'll be able to deliver your child free from HIV. And practice safe sex if you must have to do that. To test for HIV, if you think you must have been exposed to HIV sin or anything, instead of living in fear and anxiety, the best thing is to test and know your HIV status. Even though you are not exposed, but just feel like you should know your HIV status. Earlier the better. If you happen to be positive, you start your treatment earlier. If you're not, you're on a safer side. And like I said, if you think you're exposed, maybe in accident sin or anything, maybe in case of rape, there's an emergency pill that will be given that will stop the HIV from penetrating into your cell. It's called post-exposure therapy. Also, there is another drug, but it's taken before the exposure, especially for healthcare workers. It's called pre-exposure prophylaxis. And this drug has to be taken within 72 hours of the incident. But if at all you didn't get access to this and 72 hours is over, you should go to the hospital and get tested 23 to 90 days after the incident, because that is when this test will be visible on the test strip. If you go earlier than this, you may test negative while the result may be positive. Okay. So while waiting for these 23 to 90 days to be tested, you should abstain from anything that have to do with sexual intercourse, anything that will expose someone or will endanger someone's health, in case you test positive. And another thing I would like to say is not to revenge. If you tested positive for HIV, maybe someone so dear to you transfer it to you, or maybe knowingly or unknowingly, and then you become aggressive. The best thing is not for you to revenge by sharing it to people. Like that is, oh, it's someone that gave it to me now. Let's see, I'll show them. Then you open your body and be sharing it, because that is the easiest way you can give HIV. You allow everybody to come into your body and go. That is not good. Before God and man, you're being wicked, and apart from that, you're exposing yourself to other infection, because the person you are trying to infect, you don't know what they are carrying. And as someone whose immune system has been compromised, you can easily be infected. And if you may even get something worse than what you are having from them. You don't know if they are doing the same thing you think you are doing by practicing unprotected sex. So it's not a wise thing to do. And if you are infected by your spouse, anybody, the best thing is for you to forgive. I know it's difficult. It is difficult to forgive, especially in this case, but you have to try. Make peace with yourself, make peace with God. He will help you to forgive and live your life normally. Just like I said, that those with HIV can live a normal life with help of drug. Even as you draw closer to God, you may even become better. He will heal you, and that is over. You live your life fully. All of us are going to die one day, yes, but we are only praying to stay longer and achieve our dreams. So if with the help of drug you can achieve that which you are supposed to achieve, then what is need of killing yourself over it or trying to make other person's life miserable? And remember that it's something that has to do with immune, and everybody's body react differently. And that is not to share sharp objects with anybody at all, be it clipper, razor, shaving pick, name it. Even though with your family member, it's not like your family member have HIV, but for you to form the habit of not sharing sharp objects, because if you have formed the habit of sharing, you might mistakenly share with someone you don't know who might have HIV. So the best thing is to start with the family. Don't share sharp objects with anybody. This comes to the end of today's video. I hope you enjoyed this video and I hope you found it useful. Please, if you did, give me a thumbs up, smash that subscribe button and also the bell icon for weekly updates. Thank you for watching and do have yourself a good day. Bye bye.